Hello, hello. Welcome back to Hear Dr. B, where we talk all things hearing health related. First off, after a lengthy discussion with my legal team, I'm supposed to tell you this is not medical advice. 100% not medical advice. This is just for education and information. Help you be as informed as you can be when you meet with your physician. So, now that the legal mumbo jumbo is out of the way, you can also read a bit more about it at the bottom of the description. Anywho, trying to pick a topic where to start in the wide world of ears. So, after long debate, I think we had to start with earwax. That's probably one of the most common things I get asked about, and everybody's got it. So I figured let's start there. So first off, what the heck is earwax and why do we get it? So earwax has several different purposes. It is protective. It's a sticky trap designed to collect debris, dust, bacteria, which is similar to bacteria, and any foreign particles trying to make their way into your ear. You want wax there. It's a nice natural barrier. It's moisturizing. Keeps the ear canal skin nice and clean. And a lot of people run into issues once they start cleaning it away with Q-tips. I'm looking at all you Q-tippers out there. So when you wipe away this moisturizing nice layer, the skin gets dry. What happens when it gets dry? It gets a little itchy. So what do? You itch it. You scratch the skin a little bit because the skin in the ear canal is one of the only places on the body where the skin's sitting right on bone. Causes some irritation. Skin wants to heal, so just like a rug burn, it starts to weep a little bit, have a little moisture, then your ears feel moist. Oof, then you have to use a Q-tip, right? No. This is a vicious cycle I see tons of patients in, and just a little bit of earwax would have helped avoid the whole situation. So we like earwax, and it serves a lot of purposes. So leave it alone. Let it do its thing. When it's ready for you to take it out, it works its way towards the edge, and all you have to do is use a little towel and your finger when you get out of the shower and just kind of scoop it out of that bowl part of your ear, the conchal bowl, and that takes care of it. So, diving in a little deeper, we can discuss where earwax is actually made or how your body actually produces the earwax. So, in the ear canal, you have the skin, and then within the skin, you have two types of glands there. You have sebaceous glands and ceruminous glands. Now, another name for earwax is cerumen. So, sure, the ceruminous glands do contribute to the earwax. But the final product, what I'm cleaning out of people's ears and what you're seeing on the tip of the Q-tip is much more than just the secretion from the ceruminous glands. You also have those sebaceous glands secreting a fatty oil. So that combines with the dead skin that flakes off as the skin layer renews itself. So it's that combination of the secretion from the ceruminous gland, the cerumen, the secretion from the sebaceous gland, known as sebum, and dead skin, plus dust, debris, and whatever else is trying to make its way into your ear canal. So the bottom line is, earwax is your friend, believe it or not. I know you think it's gross. You love using your Q-tip after you shower. You just have to fight the urge to do it. You want that little layer there. It's healthy for you. It's good for you. So for the sake of your ears, please, just leave them alone. Moving right along, one thing that's interesting is that while earwax has the same basic composition, it can have several different colors or textures, and some of that is your diet, some of that is where you're genetically from. So it can range from yellow to orange to golden to pale to red. It can be very dry and flaky. It can be moist and gooey. So all these are within the range of normal. So the next thing to talk about when we're on the discussion of earwax is what to do about it. So we did talk about using a towel on your finger and not using Q-tips. That would be my best advice for keeping your ear canal nice and healthy. Now, I was just in New York for an endoscopic ear course, and it blew my mind how every corner there was a nail salon, and at every nail salon they had an advertisement for ear candling. Please do not get ear candling done. There's actually a paper, so somebody studied this to see if it worked, how it worked, and published it in a major journal. Long story short, spoiler alert, ear candling does not work. They light the paper on fire. The thought is the heat creates a little vacuum, sucks the wax out. And then you cut open the paper after you're done using it, and you see all the debris in there, and you're excited because, ooh, that's not in my ear anymore. It feels amazing. The couple of things the study looked at was, one, does the fire create a negative pressure of a vacuum at the tip of that cone so that it can actually pull the earwax out and suck it out? And no, there is no negative pressure created by that. So when you put a flaming piece of paper in your ear, it's dangerous, so you want to avoid that. But also, it's not even creating that vacuum effect that you're hoping for. And you're going to say, wait, Dr. B, when I cut it open, it's full of junk. Yeah, that's actually the paper and the oils they use in the paper, so when it burns, it makes the debris. It looks nice. Doesn't work. Please don't do it. What else can we talk about related to earwax? Hydrogen peroxide. Lots of people love using hydrogen peroxide or alcohol or some mixture thereof in their ears. You do have to be a bit careful. Peroxide and alcohol, they can dry out the ear canal skin, and you can go right into that vicious cycle of dryness, causing some irritation to the skin wanting to protect itself, so it's secreting a little bit extra. Then the ear feels moist or itchy, and then you itch it, and then the skin's irritated, and then the skin wants to heal itself, so it secretes more. So just avoid this whole vicious cycle. Mineral oil is a pretty benign, safe thing to use in the ear. And this is for people with generally healthy ears. I'm not talking about post-surgical ears or patients with holes in the ears or recurrent ear infections. So if you've never really had major ear issues, don't go overboard. When I say use mineral oil, I'm talking a couple times a month, not a couple times a day, or even every day is too much. Typically, once or twice a week is more than enough, and once or twice a month will be perfectly fine for your ears. Helps keep everything moist and happy. And the last thing is, earwax is interesting because you can look in an ear canal and it can be 95% completely packed full of wax, and your hearing will actually be normal. But it's when that last little bit gets covered that the hearing drops. So anytime you have a change in hearing, don't just think, oh, it's the earwax. It takes a lot of earwax in the right spots to actually block your hearing. So if you do notice a decrease in hearing on one side, or your voice or internal sounds get louder on one side, go see your doctor. No questions about it. Don't say it's earwax. Don't clean it out with a Q-tip. Probably it's not going to work. Go see a doc. Get a hearing test. Let them sort you out. And there we have it. I guess this is not the first, but the first real informational episode of Hear Dr. B. Very excited. I hope you all like it. Hope you all learn something about it. And not sure what I'm going to talk about next. I'm thinking tinnitus. Lots of people have ringing in their ears. I forget why. Oh, I was out this weekend and there was some loud music and my ears actually started ringing a little bit. I was in a workout class actually, and my watch was telling me that I was over 90 decibels where I was. So, and I noticed when I left the room, my ears started ringing a bit. So, tune in next time. We'll talk about ringing of the ears, what causes it, what does it mean, and what you can do about it. So thank you again for joining me on Here Dr. B, where we talk all things hearing health related. I will catch you next time. Please leave me comments, suggestions, ideas, topics, thoughts, whatever you think down in the comment section. And you can also subscribe. And then the next time I make a new video, hopefully within the next week, you get notified and you can be one of the first people to watch it.